Time to go inside your health. When selecting a doctor, patients often have a preference on if they feel more comfortable with a man or a woman as their doctor. But could that actually make a difference on your medical care? There's a new study suggesting that for women, having a woman as your physician may be an advantage. So here to break down and offer a little perspective on all of this, we have our KSTP health expert, Dr. Arkel Georgiou, joining us now. Tell us more about what this study found.
Yeah, this is getting a lot of play. So this study looked at data for 3 years from almost 800,000 patients. They were all hospitalized patients. They were all Medicare patients over the age of 65. And they were in the hospital because of an urgent or emergent situation. So what that implies is that the doctor assigned to them was pretty random, right? It's not like they went in with an established physician. And what it showed is that when they looked at the mortality rate, the 30-day mortality rate, and the readmission rate over 30 days, women who had female physicians had a lower risk of death and a lower risk of getting readmitted to the hospital. Now, I put the numbers up there because I think it's really important to see how small the numbers are. But on the mortality side, that means one more woman out of every 417 will survive, and one woman out of 208 will not get readmitted if they're treated by a physician, according to this study result.
These are some interesting
Very
numbers.
interesting.
I know you love diving into this kind of thing. What is your reaction to seeing these numbers?
It's easy to think that I would be biased because I'm a female physician, but I have to say that the data has shown us time after time, this is not the first study to show this, is that female physicians, on average, communicate more effectively, are more likely to prescribe preventive care and follow standard of care guidelines. And even studies that look at surgical outcomes, male versus female physicians, on average, female physicians have better outcomes and lower complication rates as well. But let's remember that it's on average, so I'm not surprised.
Okay, all right, what do you say to someone then watching this and maybe they say they specifically want one physician versus another, and what do you do to advocate for yourself?
So the most important thing to remember is when you have a primary care physician and you have an established relationship, always go to the doctor, whether it's specialty, location, gender, that you feel most comfortable with. So I think that's really valid if it's a PCP. But when you get admitted to the hospital in an urgent or emergent situation, you probably don't have a choice because it's a 50-50 chance based on the statistics of how many doctors are male versus female. So in that situation, I say speak up for your health by doing the following. One is be really clear about your symptoms, and most importantly, don't minimize your symptoms. Don't say, oh, I'm having chest pain, but maybe it's just anxiety. Don't just. Tell them your symptoms. The other thing is raise your concerns. If you're afraid you're having a heart attack, say, I'm afraid I'm having a heart attack, or a stroke, or a kidney stone, or whatever the case may be. Don't minimize it. And then finally, you're going to see many doctors during your stay. Don't assume that the first doctor talked to the second one and they all read everything you took. Repeat yourself over and over. You don't know when a little piece of information is going to make a light bulb go off in one person's mind to make all the difference in the world.
Yeah, great advice. Arkel, thank you so much. All right, we will be right back.